Yeah, just a quick review of the KARM Plus size knee brace. So this brace is specifically made for people that are having knee pain or having some kind of problem with their knee. And the idea here is that you put on the brace and it kind of supports the joint and supports the surrounding soft tissues around the knee. And then it restricts the motion of the knee. So that way the knee has a chance to rest, recover, and not get so stressed out as you're doing things. So it takes a lot of stress off your knee. So a few points about this particular brace. So this is a little bit larger brace, but it's not just for people who are maybe really overweight. It's also people for like bodybuilders who have really thick muscular legs, or anybody. So just a bigger, larger size, which I think is nice. It does have an inner gel pad around your patella or your kneecap, which is nice if you're having any trouble with stabilizing your patella. Maybe you've had a patellar dislocation. This will be good to help stabilize that. It also does have some side stabilizers you can't see here, but they're inside, here along the side. Little stabilizers on each side. That gives you a little medial lateral side to side support. So if you do need that, you're covered there. It also does have these anti-slip strips on the inside. So on the inside of it, they kind of like these little, it kind of like makes it stick a little bit so that way the whole brace doesn't slide down. Because a lot of problems with a lot of braces that they will start falling down as you get active and you get moving around. But with these anti-slip strips, that takes care of a lot of that problem. Last thing I really like about this particular brace is that it's machine washable. You can just throw it in the washer and wash it. You don't have to hand wash it. A lot of these ones I've been looking at, you have to hand wash only, which is kind of a pain in the butt. But these you can machine wash it, which is fantastic. If you wear this thing a lot, especially like in the summertime, your knee gets kind of sweaty, and then after a while it's going to stink. So if you bought a couple of these, you could always wash one, and then while it's drying or whatever, then you could go ahead and just wear the other one while it's being washed, or while it's in the wash. So I really like that feature. So other things you can do for your knee besides put on a brace, as an example, I'm getting this from Bulletproof Your Knee book. If you have any kind of a knee problem, make sure that you're strengthening your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your leg, and basically it's the big stabilizer of your knee. So it provides the most stability there. And in fact, it's funny, this whole chapter basically is just looking at various knee problems, and probably just about any problem you can name with your knee. There's a study showing that you probably have a problem with your quadriceps muscle, meaning that it's either smaller than normal. If they look at it on a CT scans, look at the cross-sectional area, it might be smaller than you would expect it to be, or in most cases, it's just not as strong as it's supposed to be. So they looked at things like, knee swelling in the quadriceps. Interestingly enough, if you have just as little as 20 millimeters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of knee swelling going on, probably have a problem with your quadriceps muscle. Knee injuries, if you had any knee injuries, or find people, if you fractured your tibia, for instance, you might have a problem with your quadriceps. Ligament problems, just about any ligament you can tear or rip. Anterior cruciate ligament, also known as your ACL. You've got a posterior cruciate ligament, your PCL. Medial collateral ligament. There's studies showing if you've had that problem, like you've torn it, you probably have weak quadriceps muscle. Knee pain is enough to decrease the strength of your quadriceps. Knee arthritis in the quadriceps. Now, interestingly enough, if you take people with knee arthritis and you strengthen their quads, they actually show less progression of knee arthritis. So it's actually good to kind of keep the arthritis from getting any worse. Patellofemoral pain syndrome, and it just goes on and on. So anyway, if you have a knee problem, make sure you're strengthening. At least you could do one exercise. Make sure you're strengthening your quadriceps muscle. Okay, fine-tune control over your knee. Here they're talking about like the muscles around your hip. Sometimes a problem at the hip can cause a knee problem. So classic examples like iliotibial band syndrome. Studies have looked at people with iliotibial band syndrome. They take groups of them, they test their muscles, and they find they also are having problems with hip abductors. What that does is that muscle brings your leg out to the side. And likewise, they find if you take people with iliotibial band syndrome, this has been proven in randomized controlled trials, you strengthen their hip abductors, iliotibial band syndrome goes away. So really interesting. Optimize knee flexibility. Of course, you want to have a flexible knee. Want it to be able to bend and straighten. But hey, your knee doesn't just bend and straighten. About the last 15 degrees of you straightening your knee, it actually rotates laterally to the side. Here's a little test to see if you have that. So that's an accessory motion you'll want in your knee to have full function in it. Last thing you can do, it says increase dynamic knee stability. Here they're talking about proprioception. There's a lot of research now showing that if people have trouble with their knees, they have decreased proprioception. Now, if I suddenly turn the lights out, you could tell me whether your knee was bent or straight most of the time, in a normal state. And that's because you have these little joint receptors and receptors in the muscle that give your brain feedback as to where your knee is, if it's bent or straight. But that's not, it's not like it's gone if you have a knee problem, but it's just not is up to par as it's supposed to be. If they compare it to the other side or compare it to normals, it's just not what it's supposed to be. So a lot of problems are finding out with knee proprioception and knee pain. So yeah, a lot of things you can do if you know what to do. But hey, nothing's as quick and easy as just putting on a brace, immobilizing it, giving it time to rest and recover, stabilize it so you don't injure it anymore. So yeah, it's a good brace. Check it out.